Welcome to the Memorizing Pharmacology podcast. I'm Tony Guerra, pharmacist and author of the Memorizing Pharmacology book series, bringing you mnemonics, cases, and advice for succeeding in pharmacology. Sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Let's get started with the show. Okay, what we're going to do is Respiratory Module 5.15, Module Learning Activities, and I was asked to do them more separately, that is, to break them up into much smaller pieces so that it's easier to use in classroom. So that's what we're going to do. We'll do an asthma and allergy scenario first, and then we'll do some other activities in a future episode. Okay, so let's just start with the asthma scenario. I'll read it to you, I'll read the questions, and then I'll read the question again as we answer them. So first one, an adult patient, this is the asthma scenario. An adult patient presents to the emergency department with complaints of shortness of breath and increased work of breathing. The patient is alert and oriented times 3. So alert and oriented times 3 means they're oriented to the person, to the place, and to the time. So they know who they are, they know where they are, and they know about what time it is. The skin is pink, warm, and dry. Their blood pressure is 148/88. Temperature is 98. Pulse 92, so almost tachycardic. And then respiratory rate 24. Pulse ox 91% on room air. Assessment of the lung reveals expiratory wheezing through the lung fields. The patient has a past medical history of asthma, hypertension, and diabetes. Number 1. The nurse anticipates which of the following medications will be initially administered to the patient. A. Theophylline, B. Montelukast, C. Albuterol, and D. Salmeterol or Salmeterol. There are two ways to do this. Either you know what the answer is, or we can talk about why the other ones would not be correct. So A is theophylline. Theophylline is meant to treat, that kind of chest tightness that you're going to have with asthma or chronic bronchitis, emphysema, some other diseases. But really that chest tightness, shortness of breath, and wheezing, that's the issue. But this is a chronic medication. This is not for someone that is having shortness of breath right now. Montelukast is also more of a chronic medication. This works to block leukotriene. It's meant to treat allergies but prevent asthma attacks. Albuterol would be considered the rescue inhaler, the beta-2 agonist, and this would be, I think, the correct choice. But let's look at D. Salmeterol is going to be for chronic asthma, and wouldn't be for asthma, it would be for COPD, but it would be for a chronic condition. And so we would say that Salmeterol would not be right because this is an emergent situation, and the only emergent medication is Albuterol. All of the other ones would be more likely to be used chronically. Number 2, list the steps the nurse should take to safely administer the medication. And just want to be careful that the nurse will not actually do the inhaler for the patient. It's the nurse telling the patient how to use it. So first we're going to shake the canister, and if there is a spacer, to make sure that that's properly inserted into the spacer. Those are generally for pediatric patients or those that just don't have the dexterity to do this. They're going to breathe out and then press the inhaler and breathe in through the mouth. And they'll try to breathe in for around 10 seconds as best as they can. They'll remove the inhaler, and then the question is, how long do we wait until we get that second one? And usually we're going to wait about a minute. And what we're really doing is we're letting the medication get into the lungs. We're letting it open up the lungs. And so if the lungs are a little bit more open, it's a little bit easier to get even more medication to the site of action to the lungs. Number 3, what assessments should the nurse plan to complete after administering the medication? We're going to do vitals and lung sounds, of course, but the big ones are going to be already in here. And what we're going to do is we're going to see if there's improvement in what we had before. So we saw that the pulse was 92. Does that pulse become tachycardic? That's something that we would worry about. As you give too much albuterol, you lose that beta-2 selectivity in the lungs, and sometimes it does affect the heart. And then we would look at pulse ox, or the pulse oximetry, right now at 91%. We would hope that it would go up a little bit. And then certainly the respiratory rate of 24. We would want to see that change as well. Because generally we're expecting a respiratory rate somewhere around 12 to 16 breaths per minute. So we know that this patient is certainly in distress. Let's see. Number 4, the nurse plans on teaching the patient about using the albuterol at home. What information should be included? So first of all, make sure that they're not just told these things, that they're written down, so that maybe they have a caretaker at home that should help them. There's a couple of things with albuterol that you really want to be careful of. And most of the inhalers now have a meter on them that tells you how many puffs are left. It used to be that what you would do is you would put it in water, and if it floated sideways, it was about half full, and if it floated all the way, it was almost empty. And that's the big thing, is making sure that they don't run out of it. But also that really albuterol is a rescue inhaler, and that when the prescriber is going to say 2 puffs every 4 to 6 hours as needed, but to hopefully try to get on some chronic medication like a steroid, an inhaled steroid or something like that, to reduce the exacerbation of asthma in the first place. Number 5, what is the best method for the nurse to use to ensure that the patient is correctly using an inhaler? Really, it's a matter of, you see me do it, and now you try to do it, and making sure that they are doing it properly. This episode of the Memorizing Pharmacology podcast is sponsored by the audiobook Perils of Polypharmacy by Eric Christensen, BCGP, BCPS. He designed the book to help healthcare professionals identify the prescribing cascade and the collateral damage that can result on account of polypharmacy, provides countless case examples of common adverse effects of the prescribing cascade and complications in polypharmacy. Find it on Audible or Amazon.com, where you can get a free copy if you've never had an Audible book before. The allergy scenario is next. So a pediatric patient presents to the emergency department with complaints of shortness of breath, increased work of breathing, and cough. The patient is alert and oriented ×3. So again, that means that they are oriented to person, place, and time. They know who they are, where they are, about what time it is in the day. The skin is pink and warm and dry. Blood pressure 112/68. Let's see, temperature is 99. Pulse is 106. So they are tachycardic. Respiratory rate at 32, certainly above that normal range. And then pulse ox 90% on room air, which is also not great. So the assessment of the lung sounds revealed diminished lung sounds throughout all lung fields. The patient has a past medical history of peanut allergy. Mother tells you that they were at a birthday party, and after consumption of a cupcake, the symptoms started. So number 6, the nurse anticipates which of the following medications will likely be ordered for this patient. So you can take a chance on this one. A, diphenhydramine, B, epinephrine, C, cetirizine, and D, guaifenesin. And this is where the memorization part comes in. If you've memorized what these are for, and again, the Memorizing Pharmacology book that I kind of tout because I feel like it's so important to have that formulary of knowledge of the medications. But imagine how much easier this question is when I say the nurse anticipates which of the following medications will likely be ordered for the patient. Diphenhydramine, a first-generation antihistamine. Epinephrine, a medication for anaphylaxis. Cetirizine, a second-generation antihistamine, tends to cause less drowsiness. And guaifenesin, an expectorant. So by knowing which these are, and you see that the person is in real distress, probably had anaphylactic reaction to some peanuts in the cupcake, we would know that B, epinephrine, would be the best choice. This is a severe allergic reaction. We want to get that in right away. Thanks for listening to the Memorizing Pharmacology podcast. You can find episodes, cheat sheets, and more at memorizingpharm.com. Again, you can sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Thanks again for listening.